Hi guys, how are you? I am Mustafa Khalil, fourth medical student in MMC. I'm gonna talking today about an important situation that need a quick handle from us as a doctor because it's emergency and life-threatening condition. It's called cardiac tamponade. Tamponade refers to the pressure which obstructs the blood flow, and the cardiac refers to the heart. So the cardiac tamponade, meaning the pericardial sac around the heart, full with fluid or blood, causing an increase in intrapericardial pressure that compress the heart so it can no longer fill with blood. Normally, the heart sits inside the pericardial sac. The pericardial sac consists of the two layers. The outer layer is called the fibrous pericardial. It keeps the heart in its place inside the chest cavity, and the inner layer is called the serous pericardial. The serous pericardial includes the pericardial cavity, and it's filled with small amount of the fluid that the heart slips around as it's beat. Because the cell of the serous pericardial secrete and reabsorb fluid, so usually there is no more than 50 milliliter of fluid in the pericardial cavity. Pericardial effusion, meaning there are more than 150 milliliter of the fluid around the heart in the pericardial sac that can develop into the cardiac tamponade, dependent on how much and how quickly accumulation of the fluid around the heart, that also leading to cardiac tamponade and compress the heart chamber to lead to the low oxygen. There are more than one cause leading to the cardiac tamponade. The first one is a car accident, that there are a crash in the small vessels around the chest and heart. Another cause is a stab wound injury that cut the small vessels around the heart, that meaning the accumulation of the blood in the pericardial sac. Another cause, an important cause, is ischemic heart disease. The patient suffer from the MI. After a few days, may there are a rupture in the left ventricle leading to the pericardial sac effusion and cardiac tamponade. It's also there are a long-term cause like a cancers, hypothyroidism, a chronic inflammation, and pericarditis. Also, these causes may lead to the cardiac tamponade. All patients suffer from the increase in the heart rate, hypotension, and decrease in CpO2. Now we're gonna talk about the symptom and signs of the tamponade. The tamponade means the heart doesn't stretch out fully between the contractions, so the chambers don't fill properly. When the chamber don't fill properly, there are less cardiac output. Less cardiac output meaning the hypotension. The patient suffer from the hypotension, meaning the less blood to the organ and less oxygen to the organ. So to compensate that, the heart beat will faster and tachycardia. So now the patient suffer from the hypotension and tachycardia. Another symptom, and it's a classic symptoms, it's pulses paradoxes. The tamponade patient, during the inhalation, there are a systolic blood pressure drop. In the patient suffer from the cardiac tamponade, the right ventricle can't move into the pericardial sac because the fluid or blood. So the extra volume push the intraventricular septum to the left, that lead to less left ventricle diastolic volume. Less left ventricle diastolic volume leading to lower stroke volume. Lower stroke volume will lead to the drop in the systolic blood pressure during the inspiration. You always should know a decrease in the systolic blood pressure more than 10 millimeter of mercury called the pulse paradoxic. Pulse paradoxic, it's a classic signs for the cardiac tamponade, but it's not specific because it's always related to the another disease like congestive heart failure, acute asthma, a chronic obstructive pulmonary disease, may tension pneumothorax, and pericarditis. So you should know that. Another symptom, and it's important symptom, it's a jugular vein distension. In the tamponade, there also a trouble in the upper heart chamber. The atria can distend enough to accumulate the venous blood of heart. So the blood will have nowhere to go. So back into the vein. It's also typical why the C distant jugular vein in the patient with cardiac tamponade. So when the patient suffer from the cardiac tamponade, come to the emergency department, the four hallmark symptom is a cardiac tachycardia, hypotension, jugular vein distension, and pulse paradoxical. Plus, may there are another symptoms like a distant heart sound, dyspnea, weakness, fatigue, and lightheadedness. When we talk about diagnosis or how we can diagnose the cardiac tamponade, there are four ways to diagnose the cardiac tamponade. The first one is by the chest X-ray. The chest X-ray will show the slight widening and a large ending of the heart sac, kind of how a water balloon has a shape. So the cardiac tamponade patient X-ray will show the water balloon shape of the heart. The another way is echocardiogram. We show the excessive fluid and the heart swelling inside the pericardial cavity. The third way by the ECG. The ECG will show the low QRS complex voltage and electrical alternance when the QRS have a different highest, and also maybe see the ST segment elevation and PR interval depression. The fourth and more important diagnostic is a hemodynamic monitoring. When we measure after a big tube is placed inside the heart, it's called the Swann catheter. The Swann catheter uses to measure the heart pressure for a clinical ill patient. So we will see a high pressure and equal inside the fourth chamber of the heart in patient with suffer from the cardiac tamponade, meaning the increase in the CVP, central vein pressure, and low cardiac output. When we talk about how we can treat the pericardial effusion cardiac tamponade, there are a procedure called the pericardiocentesis, when you stick a big fat needle into the pericardium heart sac to drain all the fluid or blood around the heart. In this procedure, we always need to keep when the cardiac monitor. Two, and important is the catheter attached to drainage system. And third, and the most important, is to assess drainage types like a fluid or blood or slow or fast drainage. Thank you so much for your listening. It's a cardiac tamponade. Thank you.